My nipples were literally scabbed over and bleeding. Her latch was so pinchy and shallow. We tried every technique in the book to try and open up that latch, but nothing was working. My lactation consultant was like, she has tongue tie and lip tie really bad. So I brought it up to my pediatric provider and they put in a referral to an ear, nose, and throat doctor who specialized in doing the tongue tie and lip tie procedure. The procedure was very quick, probably less than 60 seconds. Don't let anyone tell you that this procedure is not painful for your baby, because it is absolutely painful. She cried and was definitely like a little bit irritated for the rest of the day and very cuddly. There was a little bit more bleeding than what I was comfortable with. I tried to breastfeed her right after and my whole boob was covered in blood. She ended up not latching for me, and so we did give her a bottle of breast milk. The bleeding stopped within a couple of minutes, but I wasn't really prepared for the amount of bleeding and the amount of crying. The doctor that did our procedure was truly really, really good, but just watching that as a parent was much worse than what I had anticipated or expected. At the end of the day, I am very happy that I had the procedure done. We were able to retrain my daughter to successfully breastfeed. She's now 7 months old and still going strong.
Look at how pretty. It's Kira. You ready to go to your appointment, baby girl? My little happy bappy. This is her little outfit she's wearing. We have our little pink bow, our flower onesie, and then I'm going to put these shoes on her. This is her little swaddle blanket I'm bringing. I always bring her a blanket to tuck her into her car seat. Today we are trying to latch her, so I'm going to bring my Snuggle Me breastfeeding pillow. I just pumped some breast milk and I'm going to bring a bottle just in case like I have trouble latching her and I need milk for whatever reason. This pump I got 70 on one side and 80 on the other side.
Getting her to-go bag ready.
Mommy's having an all black moment. I have a loose fitting shirt, some really comfy yoga pants. I'm wearing my nursing bra, and then of course my perfume, sunglasses, and jewelry. Also wearing my platform slippers. I love these from Amazon. We got a clean diaper on. Look at those little toes, those little baby toes. We're dressed. We got our outfit on. You like looking at yourself in the mirror. Are we ready to get moving? Yeah. She's gonna wear these adorable little socks with her slippers. They're definitely too big.
She's so tiny, only 12 days old and in preemie size. And the bow is so adorable. It's like the size of her head.
Are we all ready? Anything else we need to do? Say no, we're ready to go, Mama. Look at my roses blooming. Goodness. They're so pretty. Look at this one.
If I'm being honest, the procedure was actually much worse than I thought it was going to be. They take the sterile scissors that you see here and they clip the frenulum under the tongue and under the top lip. It is a very quick procedure, but it causes baby pain and there is crying involved. This is her directly after the procedure. She fell right asleep after crying for less than a minute. She did have some bleeding too that stopped right away after the procedure was over.
She will not latch. She's really frustrated, so we're gonna do a bottle and just keep trying. I'll probably get an appointment with lactation, but Dad is changing her diaper right now.
I expected to have this procedure done and then my daughter would latch right away, but that was not the case. At this point, I felt horrible as a parent, and I felt like, why would I put her through this when it didn't work? It was an emotional day.
We got a very short latch on the left side doing cross cradle, but it was after a bottle. So she still is wanting the bottle and really kind of panicking until she gets the bottle. And so we're probably going to start having to implement feeds like slow feeds, syringe feeds at the breast and things like that, where I need like double assistance from my husband. And yeah, we'll have to just retrain until we can get her to latch. I did get her to latch for like probably 5 to 7 minutes on the left. So that is really good progress. But that was after a bottle. So now she's no longer hungry. My boobs are leaking all over the place. So now we're pumping. We have Miss Beautiful Girl over here. He's so happy. She is. She's such a good girl. Hi. Hi, Mommy. You're so pretty. You're so pretty. I want to talk about the procedure really quick, the lip and tongue tie procedure. So we went in and they ask you to bring the baby in hungry because the milk has certain properties in it that can prevent infection. And also when you latch or feed with a bottle, it can compress the area and stop bleeding because with the procedure, there is going to be a little bit of bleeding. I was previously told that they don't really have nerve endings in those areas and that it won't really hurt them. But when I talked to the ear, nose, and throat doctor who actually did the procedure, he said, yes, it will hurt her. But it's temporary pain and we will, do whatever we can after to comfort her. And so basically what they do is they take a really sharp pair of like tiny little scissors and a like I don't know if you've heard of like a tongue blade where it's just where they like push the lip out of the way just to hold it out of the way, and then they literally snip the frenulum under the tongue and then a little bit of like deep tissue that's under the upper lip. Then they're going to push their finger back on the tissue, putting pressure on it to kind of like pull that skin back, and the baby is going to be screaming. It's so hard to watch it as a parent. It's very quick. I mean, it took him like 60 seconds to do it. He was very, very good. What are you doing, Mama? You want it back? And then immediately after the procedure, he'll want you to feed. The doctor will want you to feed. And so what I did is I brought my breastfeeding pillow with me and I tried to latch her because she was brought hungry to the appointment and she's used to bottle feeding. She was kind of like panicking and throwing her head back and really worked up, and you could tell she was very uncomfortable and she just didn't want to latch. She kept throwing her head back. She would have like a couple sucks and then she would let go. Kept throwing her head back, throwing her head back. I could never get her to latch, and there was some bleeding to where there was blood on my nipple and we had gauze and we were wiping up the blood and trying to latch her, and then she was swallowing the blood and then not wanting to latch, and it was just like a whole cycle. So I think we tried to latch her maybe like less than 5 minutes, maybe like 3 minutes. We tried to latch her and we couldn't get her to latch. And so I just was like, I asked my husband, I'm like, just give me the bottle, because I had pumped breast milk before. And so we gave her the bottle full of breast milk, and I then paused the bottle, tried to latch her again in a different position, and I still couldn't get her latched. It was kind of like the same thing where there was some bleeding. We were wiping up the blood, and we never did achieve like a solid latch. She did get like a little bit of milk through the nipple, but never got like a consistent solid latch, and ended up getting like a 70 ml bottle. And then right after that, the bleeding stopped after we gave her the bottle full of breast milk, and then she just fell asleep and was comfortable and happy and fine, and we put her in the car seat. She slept all the way home. And then since then I've tried to latch. This is like the third time I tried to latch, and she does the same thing where she just wants a bottle. She's hungry and just does not want to latch onto the breast. She gets a little bit like worked up and frustrated. And then this last time, so the third time I tried, she did latch for about like 5 to 7 minutes and definitely got some milk. Like I saw it dripping out of her mouth, and she was swallowing and doing really well. I still think the feeding was a little pinchy, but it didn't hurt as bad as before, which is the whole reason why we did this procedure, is because when she was feeding, she was literally like chomping my nipple down to the point where when she would let go, my nipple would be like squished like a hamburger. And then my nipples started cracking and bleeding and blistering, and it was so painful. So I had to use Meta Honey patches and get them all healed up. And then once they healed, now I can try and breastfeed again. So we're kind of starting over. She's 12 days old right now, and we're just gonna have to take the steps to train her to breastfeed again, because now she's so used to the bottle that she doesn't really want to work to breastfeed, because she knows she can just get it so easy from the bottle. So yeah, that's where we're at. And I'm just so proud of her for getting through today. It was so hard watching her go through that, and just watching her become frustrated with breastfeeding and stuff. After the second time I tried to breastfeed, I kind of got a little overwhelmed and started crying because she didn't want to breastfeed, and she was a little bit fussy. And even when I gave her the bottle, she only wanted half of it, where usually she'll take the whole thing really easy. So I could tell that her mouth was a little sore, and it just made me sad to see her sore, and just, it was overwhelming, the procedure. And so I started crying. But she's doing really good. There hasn't been any bleeding since, and I think that I'm really, really hopeful that we're going to be able to breastfeed very soon. So this is the start of the journey of trying to retrain her to breastfeed after giving her a bottle exclusively pumping breast milk for the last 12 days. So what I did is I just pulled up 10 mLs of breast milk into syringes, and I attached this little catheter here. I'm going to slow feed her with a glove with my finger in her mouth. This is what I use at work. It works really, really well. You just slip this, it's just a plastic sheath, into the mouth, and you just slow feed them. That way they don't get used to just sucking down so much milk at one time. You're kind of retraining them to how they would get the milk from the breast. The only issue with syringe feeding is that it's pretty time consuming, and it's much easier if you can do it with 2 people. But if you're not consistent with it, and they get back used to the bottle. And so I'm struggling with that right now, because I don't want to stay up all night doing syringe feedings with her. And so I'm like, should I introduce it slowly and do, partial bottle and partial syringe feedings? She still won't latch. Every time I try to latch her, she just throws her head back and she screams, and she wants that bottle. Also, the pacifier, interferes with breastfeeding as well. They get used to that nipple, and it does make a difference. So, but, she won't calm down, and so I'll give her the pacifier. So it's very counterproductive, but we're working on it. And I'm going to make an appointment with a lactation consultant and see if she has any tips for me, and just try to give her the pacifier less, give her the bottle less, and work on those syringe feedings so we can slow down these feedings and get her not used to having so much milk at once. So we are working on it, and I'm just hoping that soon I can breastfeed her, because exclusively pumping is a lot of work.
In later videos after this, you're gonna see that my baby, 2 months later, after this procedure, after training and training her, finally started latching with a nipple shield. Like one day she just decided she wanted to do it. And then one day she just decided she didn't want the nipple shield anymore. And now she is 7 months and is breastfeeding beautifully. And I'm so happy that I got her tongue tie and her lip tie fixed, because the latch was so painful. Not only did she have a shallow latch to the point where my nipples were like scabbing over and bleeding, that isn't even the only issue with tongue and lip tie. Kids who have tongue tie and lip tie and it isn't caught and fixed early can also have problems with dental, like their 2 front teeth separate. It can cause large gaps in the teeth, and then it can also cause issues with speech. So it can cause speech impediments and also problems with eating. And so there's just a lot of reasons to get tongue tie fixed, even though it is like horrible to watch your baby go through that at such a young age. Overall, I'm happy I did it. I'm happy it's healed and over with, and she's breastfeeding well, and I'm just so in love with this little girl and so blessed that I get to be her mommy.